Diastasis recti occurs when the two sides of the rectus abdominis, commonly known as the six-pack muscle, do not fully come together at the midline. This can happen after abdominal surgeries like emergency C-sections, by carrying a lot of body fat around, or really any condition that will cause your belly to be pushed outward. Obviously, if the underlying factor is not resolved, such as pregnancy or obesity, it isn't going to improve. So you need to have the baby and shed the body fat first before thinking about the cosmetic results. Also, a very important disclaimer, this is not a substitute for medical advice. Yes, I'm a doctor, but I'm not your doctor. You need to see your doctor or other qualified healthcare professional before engaging in this or any other exercise program. In many cases, particularly after abdominal surgery, there's a certain period of time post-operatively where exercise is contraindicated, and medical clearance is especially important in these situations. All that being said, swipe left for more. Because diastasis recti involves a ligamentous structure connecting the two sides of the rectus abdominis, failing to close to the midline, it's only partially correctable with therapeutic exercise. It requires surgical intervention to actually repair the defect. However, you can significantly improve the defect by strengthening your transverse abdominis, which is a sheath-like muscle that surrounds your abdominal cavity and cinches everything tight, sort of like a corset. Targeting this muscle involves a great deal of mind-muscle connection, which most people don't have. I recently made a couple of posts that addresses how to engage the transverse abdominis while doing things like hollow body holds and using a posterior pelvic tilt. Please refer to those as well. If you're interested in strengthening the transverse abdominis without worsening the diastasis, what you need to do is focus on exercises that do not involve bending forward at the trunk. This means no crunches and no sit-ups. Focus on exercises that engage the transverse abdominis while maintaining a neutral spine. Two examples of useful exercises are planks and pull-off holds. If you're advanced enough, roll-outs are another good option. Just like with anything else, the key is incremental progress. If you can hold a 30-second plank, try for a 45-second plank, then a minute, then add a plate to your back, or use a one-leg variation. If you're doing pull-off holds, add resistance as you get stronger. Don't just get to a certain point and stay there. In order to see continued progress, you have to keep increasing the challenge as your body adapts. So, if you're looking for one weird trick, sorry, it doesn't exist. The only quick fix is surgery, and it may take a couple months of doing planks and pull-off holds regularly for you to see a difference.